Hi, my name is Dr. Kennedy and I work at Team Dental. So today we're going to talk about an MSE or a maxillary skeletal expander. So what is an MSE? An MSE is an orthodontic appliance that is custom fitted to the roof of your mouth and is used to create expansion. What does an MSE treat? An MSE treats snoring, sleep apnea, mouth breathing, malocclusion, or the incorrect alignment of your teeth, as well as your jaws. The MSE expands the floor of your nasal cavity as well as the nasal concha within your nose to allow for easier airflow, which gives the benefit of decreased snoring, less apnea instances with sleep apnea. MSE also contributes to less allergies. You can also experience lower blood pressure, better sleep, more energy, and many more downstream health effects from better breathing. So after expansion, you will have a gap between your two front teeth called a diastema. With this new added space, we then transition to Invisalign to close that space and make everything more aesthetic. Invisalign generally takes about 8 months to 1 year until you and I are completely satisfied with your results. Overall, I tell people to expect about 1.5 years of treatment, with Airway benefits being seen at approximately the 3 to 6 month mark. So how does an MSE actually work? After your MSE is placed, you will proceed with turning the MSE and expanding for about 2 to 3 months until the roof of your mouth splits. Most patients describe this as a release of tension or pressure. So to expand the expander, you take your key, which is custom fit to your appliance. It will fit in the keyhole, and then you will turn however much we prescribe to achieve that separation. So notice the crowding here. This is a nice before. Afterwards, you would have a space or a diastema between these two front teeth, but that space would be filled in by brand new bone, which is created by the separation. So the roof of your mouth is actually the floor of your nasal cavity. And by expanding the roof of your mouth, we're also expanding the floor of your nose. And that also includes the airway space within your nose, which allows you to breathe easier. So this is a before and after of a patient who completed MSE treatment and then traditional braces to align her teeth. You can see how narrow her archway was here, and this patient was actually missing a tooth right over here. So this is after she had her MSE, after the split, and you can see how much wider her mouth is compared to where she started. How much better breathing she has now compared to where she just was. And we were even able to add a new tooth for her where she was missing one. So here it's a little larger zoomed in. You can really see the difference between how narrow and how much larger this is. Here's some of her befores and afters. You can see how crowded and narrow this was, as well as how diminished her cheekbones kind of are, how relatively dull her skin has been looking. And then when you come to the after, she has a very nice broad smile filled in with that missing tooth. She has more pronounced cheekbones. Her skin is glowing. Aesthetically, she's very balanced in her face, and her jaw position is nice and symmetrical. So increased oxygenation will result in that lower blood pressure like we talked about, less buildup of free radicals or toxins, which you can see results in with your skin. Here you can see after expansion, the diastema that appears between your two front teeth, which then is later closed up with Invisalign. So here is a CBCT image, which is a 3D scan of your face, showing a before and after of an MSE placement. So what I'm looking at right now is the roof of your mouth, which is right here, as well as the floor of your nasal cavity, which is right here. So in the before, very narrow. Again, very narrow up here. Do you see how all these dark spaces are not as broad as the after? With the after, we have increased bone in the center here, as well as increased dark spacing here. That spacing is your airway. You are taking in all the air through here. Look at that expansion. This is your nasal passage, and as you can see, comparing the before and after, it is much wider and broader and facing less resistance. This allows you to breathe way easier.
So what's the difference between a skeletal expander and a toothborne expander?
A skeletal expander actually increases the bone on the roof of your mouth, which is giving you that airway benefit increase. A toothborne expander only slightly expands the teeth, and there are limits with how far we can expand with a toothborne expander. That's why we often suggest an MSE instead of just Invisalign on its own. So adults have very fixed bones, and a toothborne expander in adults will not yield the aesthetic results or the functional breathing results that we would want to see compared to an MSE. A toothborne expander will not expand the airway passages and will not create better breathing. Currently, there are dental practices and adults trying to utilize toothborne expanders that might think they're getting some moderate breathing improvements, but they are not actually seeing this level of airway expansion. They may be getting more tongue space, but they are not getting any true skeletal breathing benefits. At Team Dental, we are one of the leading providers in the world that is specializing in this treatment with adults and seeing these improvements. While toothborne expanders may work in children, skeletal expansion is the only proper expander for adults. So breathe easier and have a better life with an MSE expander.